Hey guys, welcome back. So for today's lesson, we'll discuss blood urea nitrogen or BUN, creatinine, and creatinine clearance. Okay, so these tests here are a part of your kidney function test. Okay, so your kidney function test is categorized according to its glomerular filtration rate, your GFR, renal blood flow, and tubular function. Okay, so it's categorized into three parts. And then the topics we will discuss now are tests to measure your renal blood flow. Okay, we will also discuss one test that is for the glomerular filtration rate, which is your clearance test, specifically your creatinine clearance. Okay, so blood urea nitrogen, creatinine, and we also have blood uric acid. These are the three tests that compose your renal blood flow na test. Okay, so bear in mind blood urea nitrogen, creatinine, and blood uric acid. Whereas kaning inyong creatinine clearance sa inyo ning clearance test. Okay, so let's start. We'll first discuss your blood urea nitrogen or your BUN. One thing you have to take note is that this is, as what I've said, a test for your renal blood flow. It is the major end product of protein and amino acid catabolism. About 25 grams of urea is excreted daily. So this is in stable nitrogen balance, okay? So BUN is a better indicator of nitrogen intake and the state of hydration, okay? So it is the first metabolite to elevate in kidney diseases. Okay, so take note ha, basta BUN, it is the first metabolite to elevate in kidney diseases. Okay, BUN is easily removed by dialysis. Please do take note that blood urea nitrogen, your BUN, is freely filtered in the glomerulus but is reabsorbed. Okay, so it is synthesized in the liver from carbon dioxide and the ammonia from the deamination of amino acids. Okay, so though CBUN, it uh it is derived from your liver, but it doesn't necessarily mean na part or routinely part siya sa imuhang liver function test. Okay? Take note na ang BUN na to, it is for the um, kidney function test sa siya kay. Remember na it is the first metabolite to elevate in kidney diseases. Okay, so next. So concentration of urea from BUN. So the concentration is expressed only by the nitrogen content of urea. As you can see here sa iyang reference value, naatay milligrams per deciliter, and we also have your millimole per liter. So to get your millimole per liter, we only have to multiply the values here sa imuhang mg per dl sa ani na value, okay? 0.35, I joke, 0.357, okay? Muna siya ang conversion factor sa inyong urea, okay? And then, we also have ang ato ang BUN to Crea ratio, it is to 10:1, pwede po 20:1. So we have different methods for your BUN determination. But first we have to consider if ang ato ang additive na ginagamit kay fluoride or citrate, it will inhibit the urease na enzyme. Okay? So fasting sample is usually not required. And then thiosemic carbazide and ferric ions are added to enhance color development, and urinary urea measurements may be used for calculations of nitrogen balance. So we have three methods sa pag-determine sa inyong BUN. We have your chemical method, your enzymatic method, and your isotope dilution mass spectrometry. So, i-discuss niyo siya further sa inyong lecture class. I, so, what you need to remember lang yun, guys, is that not all ni siya, not all, pero usually jud ang chemical method, muna siya non-specific. And then, ang enzymatic method, it is the routine method. Okay, muna siya gina-use sa mga labs. And then, ang reference method ani nila guys, kay ang isotope dilution mass spectrometry. Okay, so, daghan kayong sa mga succeeding na topics guys na itong i-discuss, daghan kayong methods na iingon. And then, base niya, maglibog na mo kung asa ni siya na method na belong, or under ba ni siya sa chemical, under ba ni siya sa enzymatic. So, as early as now, guys, I want you to prepare lang jud, like, maghimo mong table daan, or like, mag-plot mo daan, para ma-familiarize ninyo. Okay, so back to the topic. We have your chemical method, or this is your direct method. Okay, so we use the diacetyl monoxime or monoxime method, usually called your Fearon method, na reaction. Okay, so we have urea plus your DAM, okay, your diacetyl monoxime. Muna if makombine, we have your we will get a yellow diazine derivative. Okay, and then take note, chemical method, so it is non-specific. Okay, and then we also have your enzymatic method, your indirect method. This is routinely used in the laboratory. So for this method guys, hydrolysis of urea by urease. So kailangan tag urease na enzyme. So where will we get your urease? So it is from your jack beans. Okay, so as you can see, nagamit tag urease ani, and then recall lang na fluoride or citrate will inhibit urease. So dapat careful ta sa additive or tube na atong gamiton. Okay, so after urease reaction, the ammonia produced can be treated with Berthelot reagent. So ato ang unsa man Berthelot reagent? So ang Berthelot reagent nato is an alkaline solution, okay? Mainly composed of phenol, or hypochlorite. And then, what's special, or like, nganong gitreat na to ang ammonia ani? Because ammonia reacts with Berthelot agent to form a blue product. Okay? So, next up, we have your coupled urease, or your GLD method. So, this is a UV enzymatic method. Okay, have your isotope dilution mass spectrometry. Okay, so it is the reference method, but take note, dili kay reference method na siya, muna siya routinely used. Okay, so one thing, or like one disadvantage aning ato ang IDMS, or your isotope dilution mass spectrometry, it is very expensive. So luoy kayo tong mga dili ka afford. Okay, so mo nang ang mga labs usual na gini-offer nila kay kanidyong enzymatic method. Okay? So bear with me lang jud guys, aning ang tuang lesson kay dagan wordy jud kayo guys, as in. So just enjoy the show, charot. Bitaw guys, koan lang. I hope na radyo mo masabtan, okay? So next up, we have your reasons for your increased BUN and your decreased BUN. Okay, so we have your chronic renal disease. Of course, kidney function test man siya. So if increase atong BUN kay diba early indicator man siya. Meaning, kuan jud, if magka-renal disease ta, naa jud si BUN. Increase jud ato ang BUN, okay? So stress, we also have burns, high protein diet, and we also have dehydration. So sa decreased BUN nato, kay poor nutrition, hepatic disease, kay 'di ba your BUN is from your liver, 'di ba? As what I've mentioned kaniha. And then we also have impaired absorption or your celiac can be your celiac disease. So this celiac disease is a immune disease in which ang mga patients or mga people ani guys dili sila kakaon og gluten, okay, because it will damage their small intestine, okay. And then decrease BUN during pregnancy Japan, okay. Notes to remember: BUN in rises in response to renal dysfunction. Of course, na something wrong sa imong kidney, meaning mataas po di mo ang BUN, okay? So, low plasma levels of BUN are not generally considered abnormal renal function. Plasma contains 20 to 35 milligrams per deciliter of your non-protein nitrogens. So, this can be in the form of urea, amino acid, uric acid, creatine, and your ammonia, okay? Alright, so that's for BUN. Next up, we have your creatinine. So one thing you have to take note is that creatinine is an end product of muscle metabolism. So muscle metabolism, guys. The amount generated in an individual sa ato ang creatinine is proportional to the mass of skeletal muscle present, okay? And then atong creatinine is derived from creatine. So this creatine is also known as your alpha methyl guanidoacetic acid. Okay, guanido or guanidoacetic acid. So creatinine is a chemical waste product of creatine. So this creatine is an amino acid made by the liver Japan guys and also stored in the liver, okay. So this creatinine nato is partially secreted by the proximal tubules, is partially secreted by the proximal tubules, okay. And then the production rate sa tong creatinine is constant per 24 hours, okay. So please take note that creatinine is not affected by protein diet and not easily removed by dialysis. So, dili siya pareho sa tong BUN not easily can be easily removed via dialysis, okay? And then creatinine also is a waste product, okay? So, nadiri, it is not reused in the body's metabolism. So, for example, guys, there is a reabsorption of your creatinine, meaning nanay something wrong sa inyong kidney. Unsa ni naanay kidney dysfunction, okay? If mo reabsorb ato ang body og creatinine. Okay, so creatinine also a measure of completeness of 24-hour urine collection because ang creatinine nato, as what I've said, production is constant per 24 hours, okay? So, one use or like one significant use of measuring your creatinine levels, it is to evaluate your fetal kidney maturity. Okay, so as gestation progresses, more creatinine is excreted by the fetus into the amniotic fluid. So it is around 2 milligrams per deciliter. Take note to absorb creatinine and product of muscle catabolism, mainly from creatinine, not reabsorbed into the body, waste product, and then measure of the completeness of your 24-hour urine, and creatinine is a routine kidney function test. Okay, so muna siya ako ang ganahang i-absorb ninyo ani na slide, guys. So, si creatinine ninyo, we have the following reference values. So, to convert mg per dl to millimole per liter, we use the conversion factor 88.4. So, ma'am, nganong imo man ginaingon namo ning mga conversion factors? Guys, as in, manggawas ni siya sa board exam. Like, sa moang boards, dagan kayong nanggawas. Ay, like, dili dagan, pero like, nanggawas jud ang uban. Thankfully, katuro pong mga sayon. And then, namang times na mo tukar ang board of examiners, labi na karon na, di ba, bag-o na. And then, base niya na ay questions na, unsa ni kanang convert this to this, o di ba, or convert milligrams per deciliter into your millimole per liter, ana, or if maayo ra po di lang utok, ang nilara pong ipangutana kay unsa ang conversion factor. So, muna sa guys, as early as now, at least ba maka-familiar na mo para hindi kabot ninyo sa review, murag maka-dili na mo ma-Shakira, or like dili na mo manang kuan na no, lalagi ni gi-discuss, or like wala ikaw kay numdum ani. Muna siya. I would just like to point it out lang yun, guys, mo nang significance aning sige kog ingon aning conversion factor. Okay? We have here, guys, a new classification for acute kidney injury. So, si kaning manggod si creatinine, guys, kaning inyong serum creatinine, this is not kanang an early indicator na ay something wrong sa imong kidney. Okay, so dili siya kanang murag early indicator, early marker, dili pare sa inyong BUN. Kani si serum creatinine ninyo, mo rise na ni siya if 50% na ang damage sa imuhang kidney. Okay? So, I would just like to repeat na basta kuan serum creatinine, dili ni siya early indicator of kidney damage. Dapat at least 50% ang naguba sa imong kidney usa mo rise ato ang serum crea. Okay? Alright, next. So, we have here your methods for creatinine determination. So, we have to consider fasting sample is not required. So, same as your BUN, diba? Not really required man ang fasting sample. So, a 24-hour urine sample indicates the sum of the urine was probably discarded because recall that production of your creatinine is constant. Okay? Different methods na sad, guys. Kani si creatinine nato, dagan siyang methods. Around 4 ni siya. We have your method or your direct Jaffe method, your kinetic Jaffe method, and then your enzymatic method, and lastly your reference method, which is of course your isotope dilution mass spectrometry. Okay, mo na siya ang reference method, guys, pero expensive siya. Okay, so ang chemical method or your direct Jaffe method, so it is a non-specific method. It has the ability to measure creatine-like analytes. For example, your uric acid, kaning inyong mga interferences diri. So, to remove these interferences, we usually add Lloyd's reagent. Okay, so the principle of your chemical method is that creatinine reacts with alkaline picrate, okay, forming a red complex or your red tautomer. Alright, so the intensity of the color formed is proportional to the creatinine concentration in the sample, okay, so it is directly proportional, alright. So, first sa to ang chemical method, we have your Folin-Wu method. So, si Folin-Wu method, it is a sensitive but non-specific method, okay. So, next we have your Lloyd's or Fuller's Earth method. Okay, we have your adsorbent, which is this removes your interferences present in the specimen. All right, we have either your Lloyd's reagent, and we can also use your Fuller's Earth reagent. Okay, so this one is time consuming and not readily automated. So therefore, it is not routinely performed. Okay? So as what I've said, kanina ang principle sa inyong chemical method, di ba? We have your Jaffe agent, muni ang ato ang alkaline picrate. Okay? So, composition ani is we have your saturated picric acid and your 10% NaOH, okay, or your sodium hydroxide. All right. Next up, we have your kinetic Jaffe method. So, ang kinetic Jaffe method, its principle is serum is mixed with alkaline picrate solution, and the rate of change in absorbance is measured between 2 points. Kinetic Jaffe method, it is popular, inexpensive, rapid, and easy to perform, unlike your Fuller's Earth method. Okay. Next, we have your enzymatic method, or your also known as your creatinase method. So it is used to eliminate non-specificity of the Jaffe reaction because, as what I've said, basta enzymatic, it is more specific and routinely used. Okay, so first, enzymatic method here we have your creatinine aminohydrolase creatinine kinase method. Okay, so it requires a large sample of pre-incubation, so it is not widely used. And then next we have your creatinase hydrogen peroxide method. So it has the potential to replace your Jaffe method because it is specific, more specific. And then kaning ato ang creatininase is also known as your creatinine aminohydrolase na enzyme. Right? So last method for your creatinine, we have your reference method, your isotope dilution mass spectrometry. Okay, so please guys, ayun mo kalimot na mo dyan na siya yung reference method. So next, we'll discuss the reason why increase atong serum creatinine and also ngano sa decrease atong serum creatinine. Okay, so first up, we have your increased serum crea in your impaired renal function or your chronic nephritis. Because diba we discussed creatinine is not reused in the body's metabolism, alright? So it is solely a waste product. And then we also discussed kanina na basta serum creatinine, it is not a early indicator of kidney disease. So though indicator siya sa atong kidney dysfunction, pero dili siya early indicator mo nang gispecify diri na naadjutay ka ng chronic. Okay, so di ba dapat 50% ang damage sa atong kidney before siya ma-consider before mo rise atong serum crea. Alright, so another what do you call this? Another reason for your increased serum crea is also your CHF or your congestive heart failure. Alright? So next, we have your decreased serum creatinine. First up, we have your decreased muscle mass because of course, recall ato ang definition or like one thing na ganahan ako i-absorb ninyo ani natong katong slide ganiya, 'di ba? Creatinine is an end product of your muscle metabolism. Alright? So, ano siya? Derived from creatine. We also have here your advanced and severe liver disease because creatinine, as what I've said, is a chemical waste product of creatine, and then creatine is an amino acid produced by the liver. Okay, other causes of decreased serum crea can also be pregnancy or inadequate dietary protein. Okay, notes to remember. Elevated creatinine concentration is associated with abnormal renal function. Okay, so especially as it relates to atoang glomerular function. Okay, so we'll move on to our um, one of your test na considered as your katong inyong glomerular filtration rate na test. Okay, so muni siya ato ang mga clearance test. So, kani atong mga clearance test, guys, it is considered as your direct glomerular filtration rate test. Okay? Direct GFR test. This is the substance. So, kaning ato ang mga clearances, kaning mga clearance na to, these are your substances that goes or like sumasama sa ato ang urine chart Tagalog. Ganun. So, back to the topic, clearance test. So, it is the removal of the substance from plasma into urine over a fixed time. Okay? So, it represents the volume of plasma that would contribute all the solute excreted. Okay? So, muna siya, it represents the volume of plasma that would be totally cleared of the solute in 1 minute. Take note, plasma concentration and clearance is inversely proportional. Okay, inversely proportional. So as clearance of a substance declines or decreases, its concentration in plasma increases. Diba? Of course, sabotable naman siya. Okay, kay um, if if ang ato ang substance or like if a substance um, dili siya ma-excrete na to, dili na to siya mapagawas with kasama sa ato ang urine, and then of course mo taas jud iyang concentration sa ato ang plasma kay di man siya ma-excrete. Okay, next. Clearance formula. So we have here clearance expressed in millimeters per minute is equal to U over P times volume over minutes times 1.73 over A, wherein U is the concentration of the analyte in urine, P is same siya pero sa inyong plasma, and then volume of urine for 24 hours, minutes automatic 1,444 minutes ni siya guys. And then, inyuhang 1.73, constant ni siya guys, pero sa inyuhang adult. If pediatric patients gani guys, or children, ato ang gina-measure, so ato ang ginagamit is 0.17, okay? 1.73 adults, 0.17 children, okay? And then, ato ang A is your body surface of the patient. So, katuning nomogram ato ang ginagamit. So let's move on to our creatinine clearance. So when renal function is normal and stable, creatinine excretion is almost equal to its production, which depends primarily on muscle mass because, take note, number one, creatinine is not reabsorbed, it is a waste product. Number two, uh, creatinine is a end product of muscle metabolism, so magdepend siya sa muscle mass. And number three, creatinine production constant na siya per 24 hours. Okay? So the ano siya? Remains constant. So excretion is not routinely affected by diet. Okay, so it is an excellent measurement of renal function. So ang major limitation na ni guys or factor na jud no sakto ato ang creatinine clearance kay ang ato ang urine collection kay di ba 24-hour urine man ato ang sample ani. And then dapat kuan jud kanang factor jud kaayo ang accurate urine collection ani. Okay? So we have here your reference values. And then lastly, kani mura ra siyang somewhat bali ra siya sa ato ang gidiscuss kaniya. So, increased creatinine clearance, high cardiac output, okay? Pregnancy burns your carbon monoxide poisoning. And then we have your decreased creatinine clearance. Okay, number one, impaired kidney function. Of course, dili man ma-excrete atong creatinine, so mapunta ra siya sige sa ato ang like plasma, and then dili siya ma-excrete, meaning there is something wrong with your kidney. Okay, pwede sad shock or dehydration. Dehydration can also be a factor because what if dili ra jud ka kaihi kay wala kay inom-inom og tubig. Okay, we also have hemorrhage and your CHF or your congestive heart failure. Okay? So this ends our pre-recorded lecture on the topic um, BUN, creatinine, and creatinine clearance. If you have any questions, guys, please do ask me. Please send me a message, okay? And I'll see you in our next pre-recorded lecture. Bye, guys. Take care. Wash your hands.